Hello everyone. It's a pleasure for me to be with you. Ça me fait plaisir d'être avec vous aujourd'hui. Alors aujourd'hui, on va commencer avec Dr. Tam. We'll start now with Dr. Tam. I will follow afterwards, and afterwards, my colleague Carla Qualtrough will also have some news to announce. Donc, par la suite, donc Dr. Tam va aller en premier lieu. Par la suite, j'aurai une annonce, certaines informations à vous transmettre. Et par la suite, ma collègue Carla Qualtrough sera en mesure de vous transmettre l'information et répondre à vos questions. Bien entendu, il y aura Jérémy Guillot qui sera ici pour animer la période de questions. Merci.
Bonjour à toutes et à tous. Good afternoon, everyone. I'll start with the latest numbers on COVID-19 in Canada. There are now 71,486 confirmed cases, including 5,209 deaths, and 34,496, or 48% of cases, have now recovered. Labs across Canada have tested over 1,169,000 people for COVID-19 to date, with about 6% of these testing positive overall. We're now testing on average of 26 to 28,000 people daily. These numbers change quickly and are updated regularly on canada.ca/coronavirus. Today, Statistics Canada released information on excess deaths in Canada. Excess deaths is a measure of the additional deaths that have occurred over and above the expected number based on trends for previous years. It is an important way for us to understand the full impact of an extraordinary event like COVID-19 against expected mortality. La surmortalité rappelle également qu'une crise importante, comme celle de la COVID-19, peut avoir des conséquences sur la santé au-delà de la maladie elle-même, comme l'augmentation des maladies et des décès associés à des problèmes de santé mentale, à la consommation problématique de substances ou au fait que les soins de santé pour des maladies aiguës et chroniques soient retardés. It is also a reminder that a significant crisis like COVID-19 can have health consequences beyond the illness itself, such as an increased illness and death associated with mental health issues, problematic substance use, or delay in health seeking for acute and chronic health conditions. Delays in seeking urgent care for life-threatening illnesses like heart attacks or stroke can result in immediate increases in death rates, while delays in chronic disease management like diabetes care can affect medium and longer-term illness and death rates. Likewise, delayed or missed appointments for prevention visits to maintain routine vaccinations increases the risk of infectious disease outbreaks and associated illness and deaths. So, as we review these numbers that tell us of the broader impacts of COVID-19 on the health of Canadians, I am reminding everyone that it is vital to maintain health visits for yourself and your family. That includes keeping health visits for everything from prevention and vaccines to mental health and chronic disease management, and not delaying getting immediate attention for life-threatening health and mental health concerns. Healthcare providers have implemented a range of precautions to prevent the spread of COVID-19 and ensure patient safety. This includes screening patients before appointments, staggering visit times to maintain social distancing, and in some cases, making virtual appointments available. So speak with your healthcare provider to see what options are available for you and your family to safely have your health needs met. Thank you. Merci.
Merci, Dr. Tam. Ça me fait plaisir aujourd'hui de lancer un message à tous les entrepreneurs qui travaillent jour et nuit pour la survie de leur entreprise et en même temps pour assurer un retour de leurs employés au sein de leur organisation. Je sais que présentement, vous vivez une période de stress et d'anxiété et mon message pour vous aujourd'hui, et c'est le gouvernement est là pour vous. Aujourd'hui, j'ai le plaisir d'annoncer le lancement du fonds, le fonds d'aide et de relance régionale, un fonds d'environ 1 milliard de dollars qui va être géré via nos agences de développement économique régionales. Donc, les agences sont essentiellement celles en Atlantique, c'est l'APK, au Québec, DEC. En Ontario, il y en a 2, FedNord dans le nord de l'Ontario, FedDev pour le reste de la province. Pour l'Ouest, c'est l'Agence de la diversification économique de l'Ouest et pour les 3 territoires, c'est CanNord. On a déjà établi un filet social pour les gens et aussi des mesures économiques importantes pour nos entreprises. Maintenant, si vous êtes tombé entre les mailles du filet, si en tant qu'entrepreneur, en tant qu'entreprise, vous n'avez pas accès à la subvention salariale ou au prêt de 40 000 qui est disponible pour nos PME, bien, venez nous voir. Venez parler avec votre agence de développement économique parce qu'on va vouloir vous aider. Si vous êtes dans le secteur touristique, et vous n'êtes pas en mesure d'avoir accès à du financement. Si vous êtes une entreprise de Rivière-du-Loup ou de la Promenade Fleurie à Montréal, bien, on va être là pour vous aider. Et bien entendu dans le secteur touristique, mais d'autres exemples que je pourrais vous donner, c'est certainement aussi dans le secteur des technologies ou encore dans le secteur manufacturier. L'idée, c'est que nos agences vont être plus flexibles, vont être adaptées à la réalité terrain et vont être en mesure de pouvoir répondre à vos besoins. Et pourquoi on fait ça? Mais on le sait, c'est pour redémarrer notre économie et essentiellement assurer une relance équitable. So today, my message is for all hardworking entrepreneurs that are working day and night right now for the survival of their businesses and also to ensure that their employees are able to have access to a good job during and after the pandemic. So the idea right now is to provide solutions because we know that you're going through a period of stress and anxiety. My message to all entrepreneurs and to all Canadians is the government is there for you, and we've got your back. Today, we're announcing the launch of the Regional Relief and Recovery Program. This fund is a $1 billion fund that is there to help businesses. If you are a business and you fell through the cracks of the system, if you're not able to have access to the wage subsidy, if you're not able to have access to the $40,000 loan, the CEBA account, well, come and see your regional development agency and we'll be there to help. In Atlantic Canada, it is ACOA. In Quebec, it is DEC. In Ontario, in the north part of Ontario, it is FedNor. In the rest of Ontario, it's FedDev. In the west, it's Western Economic Development, WD. And also in the north, in the three territories, it's CanNor. So, for example, if you're in the tourism sector and you're not able to have access to funding, come and see us. If you're in the tech sector and you're a new startup, please feel free to contact FedDev and other agencies. Or if you're in the manufacturing sector, obviously, we're there to help. The idea is to make sure that we can offer enough flexibility and be adapted to regional realities. The agencies are close to the ground, have their eyes and ears close to the ground, and are there to help. So the goal of this program is to make sure that we restart appropriately the economy and that we can have an equitable relaunch of our economy. Merci. Thank you. Now to my colleague.
Bonjour, thank you.
Carla.
Can you hear me?
Yes, very well. Go ahead.
Excellent. Okay, well, good afternoon, everyone. I'm very pleased to be with you here today. Comme nous le savons tous très bien, au mois de mai, les étudiants partout au pays ont l'habitude de commencer leur emploi d'été. Malheureusement, nous nous trouvons dans une situation exceptionnelle. De nombreux emplois d'été ne sont plus disponibles en raison de la COVID-19, ce qui pose des défis pour les jeunes Canadiens. We believe students should be supported through these difficult times. That's why on April 22nd, the Prime Minister announced the Canada Emergency Student Benefit, a direct support to students who are struggling to find work during the summer months and who are worried about paying their bills and tuition in the fall. I'm happy to announce today that starting this Friday, May 15th, students will be able to apply for the new benefit through the Canada Revenue Agency. To help manage the volume of applications, applicants will be asked to apply over 4 days, like we did with the CERB, depending on their month of birth, and can expect their payment in 3 to 5 business days from when they are deemed eligible if they're using direct deposit. If you're a student and have never filed a tax return, you'll need to call the CRA to activate your social insurance number so that you can apply for the CESB. You'll then be able to set up a My Account and be ready to apply for the benefit this Friday. The website will be going live today with clear details on who is eligible and what Canadians need to know in order to apply when the application process begins. Le PCUE pourra être versé de mai à août aux étudiants et aux nouveaux diplômes qui ne reçoivent pas la prestation canadienne d'urgence et qui cherchent du travail sans en trouver en raison de la COVID-19. It will also be available to Canadian students studying abroad, as well as high school graduates who will be starting a post-secondary program in the coming months. Through this benefit, eligible students will receive $1,250 per month from May to August 2020, or $2,000 per month for students with disabilities or students with dependents. This money will not have to be paid back. Just like the CERB, students can make up to $1,000 over the 4-week period for which they are applying. Cette prestation pour les étudiants pourra aider environ 1 million d'étudiants à temps partiel et à temps plein qui ne peuvent pas trouver de travail. As the labor market continues to evolve, our government remains fully committed to supporting all Canadians, including the Canadians who need it most. Through important measures like the CESB, we'll continue to do what it takes. Thank you. Merci beaucoup.
Merci, Carla. Donc, maintenant, on va y aller à la période de questions.
Merci, Madame la ministre. C'est ce qui commence la période des questions. On va commencer au téléphone avec une question, un suivi. Opérateur.
Thank you. Merci. Our first question, notre première question, nous vient de Hélène Bivetti avec Le Devoir. Please go ahead. À vous la parole.
Yes, hi. My question is for Minister Qualtrough. It's regarding the benefits for students. 2 weeks ago, when this was discussed and voted in the House of Commons, opposition had problems with the benefit, and they wanted some changes, and that's why the bill that was adopted was pretty vague, and there was a promise that in the regulations there would be some additional details. You promised to the NDP that you would put it to $2,000 for students who have children, which you did. But you also promised to the Conservative Party that there would be a link between students and available jobs. And to the Bloc Québécois, you promised that the amounts of revenues that they could keep before losing the benefit could be changed and could change from the $1,000 that was first decided. So I don't see in what you're announcing today any indication that you fulfill your promise and that you listen to the opposition parties. Can you be more specific about that?
Well, thank you for the questions. It's super important to clarify. So maybe I'll go quickly through each of them. With respect to the concerns that we have direct links to available work, it's actually right in the bill itself that we have to direct students to the job bank, and in Quebec to the Quebec's equivalent. We have to tell students where they can find work, what jobs are available. With respect to the limit of income a student can earn right now by regulation, it's at the same as the CERB, but as I've said, as the situation evolves, we will continue to talk both on the CERB and the student benefit as to how we can make it easier for people to transition back into their work. And I apologize, I forget the third one. What was the third one?
Oh, the NDP, but you did made the request.
Okay. Yeah, so we worked really hard with the and we did thank you. I think the point is we worked really collaboratively on this, and by giving regulatory flexibility in this act, we can continue to respond quickly without having to go back to change the law itself.
So are you saying about the $1,000 of revenues that a student could keep, which is the same as for someone getting the CERB, are you saying that could change in the near future? Is that what I should take it away from what you're saying?
I wouldn't say the near future. I guess what I'm saying is, as we look as a government, as we head into recovery and as provinces open up their economies, there is regulatory flexibility in both cases for the CERB and the student benefit to monitor the situation and change accordingly as it evolves. But no, it would be very premature for me to say that that's coming anytime soon.
Merci. Prochaine question, opérateur.
Thank you. Merci. Our next question, notre prochaine question, is from Jim Bronsko with the Canadian Press. Please go ahead. À vous la parole. Mr. Bronsko, please unmute your line.
Yes, thank you. We're interested in knowing about testing, and now that officials have an approved antibody test, what precisely do they plan to do with it in terms of public testing, since the science on COVID-19 immunology isn't quite settled yet?
This is Theresa Tam. I'll answer this question. So yes, Health Canada authorized the sale of the first COVID-19 serologic test. So that's a test for your antibodies or your antibodies to the virus itself. So as you correctly pointed out, we don't know enough about the immunology of COVID-19. And these tests, in general, test for antibodies that appear days or weeks after the infection. So they're good as a look at what the proportion of the population has been infected, for instance. So the approach that we're taking in Canada is to use these tests, first of all, in the context of population studies. So the immunity task force that was formed just a short while ago has been really active in trying to accelerate and prioritize these tests so that we can use them to determine across the population an estimation of how many Canadians are infected in different places or different age groups or in different risk populations, for instance. So that will be the first key use. And at the same time, together with research organizations and funders such as the Canadian Institute for Health Research, we have to study the immunology, the immune response to the virus at the same time. And then we can interpret these tests as to what they mean for an individual. So it is a little premature to be able to use these tests and interpret them on that basis. From a population level, these tests will be used in conjunction with the PCR tests to look at how they can be incorporated then into a wider testing strategy. But right now, under the collaboration of the Immunity Task Force, our priority is focusing on the population survey. Also to understand there are designs of these studies over time as well, to look across at least 2 years time span to see how the population changes in terms of their antibody response. That will give us even more information about how effective are these antibodies at protecting someone maybe against a second encounter of the virus, and how long does immunity last for. So I think it's a great news that the first test has been authorized. I also feel that we are benefiting from some of the information coming from other countries where they have had some experience with serologic testing. Some of the tests didn't perform very well. So we are sort of learning from that experience as well.
En suivi?
Okay. Yes, thank you. I'm not sure who is best placed to answer this one, but once the economy starts to reopen, more people without sick leave benefits are going to be returning to work, as you know. What will the government's role be in making sure they can stay home when sick without being penalized for doing that?
I'm happy to weigh in on this one. So we're very aware that a key component to our return to work safely and positioning businesses and workers to feel confident they can go back to work will be making it easier to choose to stay home if you're feeling sick, or if you're not well, or if you're worried about having been exposed to COVID. So we're working actively with the provinces. I know this is the discussion that's happening between the premiers and the prime minister to see how we can help. As you know, right now under the CERB, if you're sick or if you are quarantined, of course, you can access the CERB, and we're going to look to see how we can continue to support Canadians moving forward and in what way we can best do that.
Merci. Dernière question au téléphone, opérateur.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Lina Dib avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour. Ma question est pour Madame Qualtrough. Si vous pouviez essayer en français, ce serait apprécié. Pouvez-vous m'expliquer d'une manière pratique de quelle façon est-ce que vous allez lier les étudiants aux emplois qui sont disponibles? Qu'est-ce que le gouvernement fédéral va faire exactement pour donc respecter cette promesse faite aux conservateurs?
Merci. C'est une question très importante. Nous savons que nous ne voulons faire rien qui désincentivise le travail. Particulièrement pour les étudiants, nous pensons qu'il y aura des opportunités partout au Canada pour les étudiants de travailler cet été. Alors, dans une des mesures que nous avons créées, c'était un additionnel 1600 jobs, emplois autour du Canada. Et puis, quand on fait l'application pour le PCUE, nous dirigeons les étudiants à la Job Bank. C'est une grande, excuse-moi, it's a portal. It's a big, excuse-moi, je ne sais pas comment l'expliquer en français, mais c'est peut-être Mélanie peut m'aider. C'est vraiment une opportunité où il y a tous les jobs sont là. Alors we're going to direct students to the job bank and help them become connected with employers. Mel?
Mélina, essentiellement, ce qu'on va faire, c'est qu'on a créé un portail dans lequel il va y avoir différentes offres d'emploi. Et donc, dans le contexte de la PCUE, les gens qui veulent appliquer auparavant devront passer par le portail et pouvoir avoir accès aux différents emplois dans leur région. Et donc, c'est ce que Carla vient de vous expliquer.
Merci. Donc, si je comprends bien, il y aura pas une obligation. Les étudiants pourront profiter de cette information-là, mais ne seront pas obligés d'avoir postulé à un emploi avant qui leur aurait été refusé avant de recevoir la PCUE. Et pouvez-vous aussi m'expliquer, parce que les étudiants finissent leurs années scolaires à différents moments, alors ceux qui commencent vendredi, j'imagine, c'est seulement pour les étudiants qui ont fini l'université, parce que les étudiants de cégep n'ont pas encore fini leur session.
Carla, please unmute yourself. We can't hear you.
Excuse-moi. Ça va dépendre quand vous terminez vos études. Alors, pour des enfants, des étudiants qui sont encore à la secondaire, alors ça va être disponible pour 2 mois seulement, mais pour les personnes dans le post-secondaire, ça va être pour les 4 mois. Et on ne va pas obliger les étudiants à prendre un certain emploi, mais ils doivent affirmer avec leur application qu'ils cherchent activement le travail. C'est plutôt qu'ils doivent affirmer qu'ils cherchent le travail, qu'ils ne refusent pas de travailler, mais qu'ils cherchent activement un travail.
Merci. We'll now go to questions in the room. Please, Mike from Global.
Thank you. Dr. Tam, can we go back to the serologic testing? How confident are you that these tests can provide officials with the information needed to help people affected by the COVID-19 stuff?
Well, I think serology tests, that's tests for the antibodies, will play an important role. We just need to be able to use them wisely, if you like, or smartly right now, which, as I've talked about, involve using them for population basis, but then at the same time study the immunology so you can interpret these tests for individual basis as well. I have to say that, Health Canada is trying to authorize the sale of these tests as carefully as they can to determine that the tests that they do authorize have met certain levels of criteria. But according to Health Canada's guidance on the serologic tests, a condition is applied to the authorization so that in order to monitor the ability of these tests to perform once they're being used in the healthcare system. We've seen how some tests perform in a lab system inside the conditions of the laboratory, and then they're used in the real-world system. How do they perform? How specific are they? Can they actually detect the specific COVID-19 antibodies or not, and also their ability to, their sensitivity or the ability to detect the antibodies when they're present. So I think all of that remains to be seen, which just means that we need to evaluate and monitor these tests as carefully as we can as they are implemented, whether they be part of these studies, which is the best way to monitor their performance, or otherwise. But so that's where we're at the moment, but it's great that we now have the first test.
Thank you. And what are the next steps to rolling this out on a countrywide basis, or what's the plan?
Yes, so as I said, the Immunity Task Force has been formed. So they've been working really, really hard to try and accelerate the process. And so they're trying to do this in a matter of the next couple of weeks. They were targeting about, I would say, by mid-May to scale up some of the fundamental work on the field work on immunity. So I think right now, the foundations are being built now that you have the first test. We're hoping to see some of rapid implementation of the actual population surveys, both general and those focusing on sort of specific communities, geographies, occupational group. And so I think they're just working as fast as they can, and hopefully this will be, quite rapid in terms of its rollout. And we're participating in provinces and existing research networks that have already been formed to look at immunity as well. And so it's a bit of a big partnership, and it, of course, involves many researchers across the country. But what we have to do, I'll just reiterate that we want the top quality immunity test identified so that you can actually do this properly.
Thank you. We'll now go to Molly from CTV.
Hi, Molly Thomas, CTV National News. My questions today are for Dr. Tam. Dr. Tam, how important is it to test asymptomatic people like Alberta is now starting to do? I mean, are you advising this right across the country, and do we have the capacity for this to roll out nationwide?
I think that's the capacity question is an important one as well, but and also one of equity. I mean, obviously, we want to make sure areas that don't have access or good access to laboratory testing all have access to that. I think we are updating our laboratory guidance as well. So with provinces and territories, all the chief medical officers, all the public health laboratories and experts, as I've said, lowering the threshold to test anyone with even mild symptoms is really key to just broaden and widen that net really, really well. And also for high-risk situations. For example, in certain settings, like not just long-term care, but maybe in homeless settings, in our correctional facilities, in some of our Indigenous populations, the moment you see someone who's sick, very rapidly testing them, and then testing even the asymptomatic contacts within some of those settings would be important. For example, in some settings, people can't tell the symptoms very well, or they may not have symptoms. So those are the priority asymptomatic people to be tested. And contacts, really, of cases or in the context of certain outbreak situations, you would want to look at the testing of asymptomatic people. Certain work sites, for example, that experience outbreaks, for example, the meat packing plants, you would want a very low threshold to test even the asymptomatic people in that setting. As to whether you should widen it for the general population, the way we're looking at it is what kind of sampling frame would you want to look at? Is it part of some of your efforts in surveillance, if you like? So right now, a number of provinces are discussing, if they have the capacity to just look at population-based and community-based testing, they're looking at those protocols. The key is that we would like to learn from across the country and the provinces who might be implementing some of these pilots, if you like, that we learn from them and see exactly what happens with the test results. And so I think that's the most important thing. But for sure, widening the net by lowering the threshold for testing people with mild symptoms will be the first layer, and then looking at what else can be done.
My second question has to do with masks, Dr. Tam. Obviously, there's more people out and about with the loosening of restrictions around the country. Quebec's premier was encouraging everyone in that province yesterday to put a mask when they walk out the door. What are the new rules? Are there new rules here? I guess is my question. I mean, should I be wearing a mask right now? Should you be wearing a mask right now? Or is there any kind of uniformity around masks in Canada?
It's a topic of great interest, I would say, all across the country. And again, with the Chief Medical Officer of Health, we're looking at this in the context of reopening or the economy. And so I think our collective thinking is still that it depends on the disease activity in your population. So according to the epidemiology and whether there's actual community transmission in your jurisdiction, it is recommended that you wear, or in the general public anyways, wearing of non-medical mask or facial covering in situations where you cannot maintain physical distancing of less than 2 meters. Some of those examples are public transport, or when you are doing certain types of retail shopping or grocery shopping, for example. But it does depend, because some jurisdictions say, well, we actually haven't had any community transmission. So in our situation, it doesn't apply as much as if you were in the middle of a much more complex, crowded city where the situation for maintaining the 2 meters is a problem. We also discussed the complexity of implementation. C'est plus facile à dire qu'à faire, comme toujours, because it's easy to make a general recommendation. But when it comes to implementation, there's a lot of complexities, not the least of which is that we did not want to discriminate or adversely affect vulnerable populations who may or may not be able to do some of the social distancing or physical distancing measures, and make sure they actually have, if you're recommending masks, you will have to make sure that people have access and be able to implement that. So I think the concern was that we must not inadvertently increase that divide and that the support that is being provided. And so there's a lot of careful thinking that needs to be done. But, I've just talked about the general overarching recommendation. And I think the other thing is that we keep having to sort of reiterate that there are tried and true measures that everyone must remember. This is going to be a difficult period for people to remember. Number one, staying home if you're sick. Number two, wash your hands frequently. Number three, cover your cough, of which adding a layer of protection, such as a non-medical mask, is an added layer of protection that people can consider under those circumstances. And so I think, it's different layers of protection, but I think must not forget all the other layers is the fundamental piece that we would like to communicate.
Thank you, Dr. Tam. We'll now go to last question in the room before we do a final round on the phone. Julie?
Julie Van Dusen, CBC. I have 2 questions for Dr. Tam. The first one I'll have to read. It was provided by a colleague. Ontario has updated their case definition of COVID-19 to include multi-system inflammatory vasculitis in children, which appears similar to Kawasaki syndrome. How significant is this? Is this the first province or territory to do so in Canada?
So again, with all the chief medical officers, we've been looking at a broadened list of symptoms or clinical conditions for considering for COVID-19. I think that pediatricians and others have already been alerted to this potential condition, multisystem vasculitis syndrome, or variants of Kawasaki disease. So it's really an alert to clinicians to think about what might be the underlying causes, because it's not specific to COVID-19. Kawasaki-like syndromes can be as a secondary effect, or your body's reaction or inflammatory and immunologic reaction to viruses and other infections. So it's not specific, but it is important to catch people who are presenting with these syndromes and further determine whether COVID-19 could be a cause. So I think it is consistent with the broader thinking across the country.
One follow-up.
And my second question is, I've heard you numerous times expressing concerns about the calamity that's going on in long-term care homes. And so as the head of Public Health Agency, I'm sure you've thought about this a lot. So I guess I'm wondering, do you think it would be best to put them under the Canada Health Act? Would it be best to have a dedicated transfer with strings attached? Well, I'm asking you as a health professional. With strings attached, i.e., if you have too many people to a room, you don't get money. If you have no inspections, you don't get money, that kind of thing. If not these two ideas, which are floating around, what's the solution?
Yes, as I've said, that the key, very tragic characteristic of our COVID-19 crisis is the impact on long-term care homes. And so, obviously providing the necessary guidance and ways to prevent the introduction of COVID-19, as well as the ways to rapidly address any outbreak, is of paramount importance at dealing with the outbreak right now. And I think going into the future, we must not let these lessons sort of be forgotten. So I think improving all of those standards and conditions for our seniors is very important. It's not just long-term care homes, seniors' residences and other places where we support our seniors are very important. And also the workers who work in those settings, including as much as possible reducing transfers between these settings will reduce the transmission of infectious disease. And so I think, really be able to review all of the lessons learned from this situation is important as we move ahead. And so I'm sure ministers will be discussing these in the context of their plans going forward.
So you have no view about whether they should go under the Canada Health Act? You have no view?
I think that's best left to our policymakers, for sure.
We'll go for one final round on the phone, please. Moderator?
Thank you. Merci. Our next question, notre prochaine question, is from Carly Weeks with the Globe and Mail. Please go ahead. À vous la parole.
Hi, this is for Dr. Tam. You had mentioned off the top about the report on excess deaths. So what we saw today from StatsCan, it doesn't really show any real spike in deaths in Canada, at least up until the period that they looked at. It also doesn't provide a cause of death or other important markers. What is your read or interpretation on what this report tells us about deaths in Canada so far this year?
Yes, so this is just for the first quarter of 2020. And so, of course, Canada's COVID-19 epidemic began to accelerate from about mid-March, but the bulk of the illnesses and deaths, of course, hadn't occurred by the end of March. So this is a preliminary look at excess mortality. And also, it is only from 9 different provinces and territories. So we're still gathering data from the rest. So it is incomplete and preliminary, but it forms a really good foundation to look at the impact of this pandemic or crisis in another way. The actual benefit of looking at excess deaths is, the fundamental question we're asking is, well, what would occur if this event had not happened? So what would have occurred in the number of deaths if this event had not happened? And then what actually happened, and could we attribute it to the COVID-19 itself? The benefit of looking at this indicator is that it does not require, it's not really skewed by any differences in the way deaths are reported or how death certificates are filled in, etc. It gives you an overarching sense of the excess deaths. And it also allows us to look at the full impact of this pandemic, whether direct or indirect. So we can talk about the direct impact of the virus, but there may be other illnesses or conditions that have increased as a result of this pandemic. So it gives you a more fulsome picture of the full impact of the pandemic itself. And so I think I see it as a preliminary sort of baseline upon which we can sort of build on. And StatsCan have said that they will be updating these tables on a monthly basis, so we can look at what happens. And I'm particularly interested in the month of April when that becomes available, because that's when a lot of the illnesses would have occurred. So maybe I'll stop there in case there was any further questions.
Well, I just have one really quick follow-up. So I've spoken to some epidemiologists today who say that, while it's a great baseline, sure, the lack of, cause of death or, place of death, such as hospital or home, it doesn't, it makes the report really limited. And that if this data doesn't become available soon, and most of the time this kind of data is only available a year or two after the fact, it's really not going to help us at all when we respond to COVID-19. So, they're concerned about this. They say it needs to be addressed. How do you respond to that?
Well, I think this is one set of data which comes from vital statistics offices of provinces and territories. We have to, as you said, and I think the concern from a number of epidemiologists or policymakers that we do have to have better data. So again, working with StatsCan, trying to improve the data on the actual COVID-19 cases. I see excess deaths as adding to that dimension, and that from this perspective, I think it's not one single indicator that's going to help us. What I have to say is it's true that mortality data usually comes after a lot of confirmations and the gathering of information and not as timely basis. But I see that vital statistics officers are trying very hard. Giving us the first quarter is actually something that, is quite an extraordinary effort, however limited it is. I'm sort of encouraged by the efforts being made by provinces that have come to at least try and put these statistics on the table. Do we still have a ways to go? Yes.
Thank you. Next question.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Philippe Vincent-Foisy avec Radio-Canada. Please go ahead. À vous la parole.
Oui, bonjour. La première question est pour la Dr Tam. J'essaie de vous suivre là parce que il y a quelques semaines, vous disiez qu'il fallait pas tester les gens asymptomatiques. Ça donnait rien parce que s'il n'y a pas de symptômes, on peut avoir des faux positifs, donc ça donne rien de les tester. Là, vous nous dites que ce serait une bonne idée de les tester, surtout dans les milieux où les gens travaillent près les uns des autres. Il y a quelques semaines, vous nous disiez que les masques, c'était même pas une recommandation parce que ça ne donnait pas grand-chose. Et là, vous nous dites, c'est une bonne idée de les mettre dans les milieux. On ne peut pas avoir 2 mètres. Est-ce que vous êtes capable de m'expliquer comment, en quelques semaines, vous avez pu changer de cap comme ça?
Donc, le plus important est de tester ou de dépister toutes les gens qui ont les symptômes, n'importe la sévérité des symptômes. Donc, même pour les gens qui ont des petits symptômes de rhume ou les problèmes de mal à la tête, par exemple, c'est vraiment une bonne idée maintenant de dépister tous les gens qui ont les symptômes. Ça, c'est la première stratégie. Mais dans certains milieux, dans certains contextes, par exemple, s'il y a une éclosion dans un environnement avec des autres risques, comme dans les maisons de soins de longue durée, dans les maisons ou les endroits pour les sans-abri, par exemple, c'est vraiment important. S'il y a même un cas de COVID-19, c'est important de tester, de dépister tous les gens dans cet environnement, même les gens qui n'ont pas les symptômes. À part de ça, il y a des pilotes, des études, par exemple, dans les autres populations, peut-être, de tester les gens qui n'ont pas les symptômes. Mais c'est là un protocole, une étude pilote.
Et j'aimerais ça vous entendre sur les masques aussi, puis sur les tests sérologiques. Qu'est-ce que ça change? Puis Mme Joly, sur le tourisme, on avait demandé du côté de l'industrie touristique de l'aide directe sectorielle pour le tourisme. Pourquoi il n'y en a pas?
On va rester avec un suivi, s'il vous plaît.
Donc, pour le test sérologique, maintenant, on a un seul test disponible qui est autorisé par Santé Canada. Et c'est vraiment important d'avoir plus de données concernant ce test. La qualité de test, par exemple. Donc, l'utilisation de tests sérologiques maintenant, c'est pour les études dans la population. Il y a un groupe de travail, un task force qui est formé pour immunity, pour déterminer l'immunité dans la population. Ça, c'est la première priorité pour le Canada. En même temps, il faut qu'on comprenne peut-être mieux l'immunologie, comment les anticorps augmentent dans le corps pour le COVID-19 en même temps. Après ça, on peut peut-être mieux interpréter, utiliser les tests diagnostiques dans la population en général. Maintenant, c'est un peu plus tôt pour utiliser le test de sérologie pour les décisions comme le tourisme maintenant. So I think I did respond before with the serologic test, which is, obviously right now, the performance of these tests needs to be carefully monitored. We're primarily using the serologic test right now in the context of population health, population studies, these cross-sectional population studies to determine who has got infected, but also to increase our research on the immunology or the immunologic response in the human body, which would then help us interpret individual diagnostics. So really right now it is too early to interpret what those test results might mean on the so-called immunologic passport, I think. For that, you need to know, what kind of test does this person have and how long ago. Well, what does it actually mean? We don't have enough of those answers to interpret these kind of questions. So really, we need more information.
Madame Joly, rapidement.
Oui, si je peux me permettre, en fait, bonne nouvelle pour le secteur touristique, il y a de l'aide. Il y a de l'aide via les subventions salariales, il y a de l'aide via les fonds de 40 000 $, donc les prêts de 40 000 $. Mais aussi, si les entreprises n'ont pas accès à ces mesures-là, bien, elles pourront désormais se tourner vers les agences de développement économique régional. Donc, j'invite les gens du secteur touristique qui sont inquiets présentement de la saison à venir nous voir. On va s'asseoir, on va trouver des solutions, puis on va être là pour eux.
Merci. Dernière question au téléphone.
Thank you. Merci. Our last question. Notre dernière question nous vient de Jamie Pashaganskam with APPN News. Please go ahead. À vous la parole.
Yes, thank you. My question is the Canada's prison system. There's another lawsuit against CSC that came out this week. When is Canada going to deal with the problem of inmates not feeling protected in Canada's prisons?
Well, do you want to give Dr. Tam? Go ahead.
So I think given the environment of our correctional facilities, it is extremely important to be able to respond, to prevent actually COVID-19 entry, but also to prevent its spread as soon as we know that there has been even a single case. So at least from the Public Health Agency's perspective, at the federal level, we've been working with Correctional Services Canada to make sure that they have the necessary infection prevention control protocols to ensure that they have the sort of technical support that is needed should they actually have a case. And we have to work with the provinces and territories and the local public health unit to make sure that testing occurs very rapidly, should there be a case for these different settings, and to ensure that there's a proper supply of personal protective equipment should there be any kind of signs of outbreak or depending on what's happening in that community. So I think instituting these infection prevention control measures are very important. It is very difficult in certain settings to do physical distancing, for example. So each of the institutions must be able to sort of look at their plans for how they're going to protect both the inmates as well as the staff. And for the staff, it's not just about because they do go back to the families and they do mix in the community, is general recommendations on preventing infection in everyone it's of paramount importance. So again, the core public health measures of essentially making sure there's proper hygienic measures, people being able to wash their hands or maintain those. Again, it's probably something that people should be extremely mindful of in the context. Environmental cleaning, not to have any crowded conditions, changing schedules to protect people. And so I think all of that is or has been worked out in the different institutions. But I know that at least from the Correctional Services Canada, they're taking this extremely seriously.
Okay, thank you. And concerning Indigenous inmates who make up the bulk of prisoners in federal prisons, has anything specifically targeted towards the Indigenous population in these prisons been looked at? For example, targeted release programs?
I'm uncertain about release programs, but what is important, I think, is the recognition at the public health level that anyone who is being released from different correctional facilities must have a plan, including plans for quarantine or isolation as appropriate. Because I think Indigenous peoples are overly represented. If they go back to a community that isn't prepared, then they need to be able to prepare with their own infection prevention control measures. So supporting people as they be released from institutions, knowing what their plan is for infection prevention control. If there are local requirements for isolation or quarantine for 14 days, for example, if that's in play, they need to be supported in order to do that, to protect themselves, but also their community. So those kind of plans are really important.
Merci. C'est ce qui conclut la conférence de presse aujourd'hui. Bonne journée.
Bye, Carla. Merci.